In this video, I'm going to show you how to relieve nerve pain in the lower back. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to focus on deep pulling motions known as decompression traction to quickly take pressure off bulging or herniated discs that may be pinching a nerve, causing pain in the lower back, possibly even sciatica going down the leg. A note about these exercises, each one works just a little bit differently. To get the best results, go through them all, use what gives you the most relief. With that being said, let's get started. Here's a really easy exercise that you can do standing that can quickly take pressure off a pinched nerve in the lower back. For this one, we're going to go next to a wall or a door. Get pretty close to it. You're going to take your hands, you're going to put them right on the door, have them roughly about shoulder width apart, and just take your fingers and crawl upward towards the ceiling as much as you can until you feel a really good stretch form in your upper back. Once you feel that, you're going to treat your hands like suction cups. So they're going to be stuck to the wall or the door. They're not going to slide. From here, what I like to do is make sure that my feet are roughly about hip width apart, and I'm going to place all of my body weight onto my heels. Just bend your knees slightly and then squat your bottom down and away from the door. The more that you go down, the more that you're going to feel a deep pulling opening stretch throughout the whole back, but really focus on feeling it into the lower back. Once you feel that, you're going to hold this one comfortably for 30 seconds. But if it feels good, you can hold it for longer. Just do nice, slow, controlled breathing. Let out as much tension as you can. From there, just relax by coming back up. But try to do this for a couple repetitions. And with each repetition, try to build into it just a little bit more. So to take this one to the next level and hopefully get some more relief, let's put the back through different motions to open it up just a little bit more. So instead of keeping your upper body straight, tilt it towards one side. So I'm kind of tilting my upper body and shoulders towards my left. What you're going to notice is it opens up the other side of the back just a little bit more. So this one is great for one-sided lower back pain and sciatica. Just tilt towards the other side. But give that a try towards the left. You can go straight, obviously, and also towards the right. If one of those positions offer more relief at that point, throw more repetitions in. So you can also do a little bit more with the hips and pelvis. Let's get back into our original stretch of having our body straight like this. But this time around, what we're going to do, again, is put all our body weight onto our heels and then swing our hips like this from side to side. I know it looks funny, but it really does work. I wouldn't do this one in public or at work. You'll probably get a meeting with HR. But do this nice and slowly for about 10 repetitions in both sides. You can also do a circular hula hoop motion like this. So do big wide circles with your hips and pelvis, maybe about 5 times counterclockwise, and then switch it up in the opposite direction and repeat. But go through all of these movements. You're going to find that one just offers a little bit more relief. At that point, throw more repetitions in. Here's a really easy exercise that you can do right at the edge of a bed. To get into position, grab a large towel. You can also roll up a comforter or a blanket, something like that, and place it right at the edge of the bed for extra comfort. And then you're just going to lie on that pillow like this. Your whole upper body is going to be supported on the bed, but your hips and legs are going to be directly off the edge. My legs are roughly hip width apart, knees bent at 90 degrees, so my knees are pointed straight down towards the floor, and I support all of my leg weight right on my toes. For the upper body, I support them on my forearms. They're roughly in a V shape, and I just put my hands together. What you want to do is allow everything throughout the whole body to relax. So don't tighten any muscles. Allow the core muscles, back, glutes, legs, everything to be nice and relaxed. But you're going to feel a deep pulling traction in the lower back, and it usually feels really, really good. I like to do nice, slow, controlled breathing and just hold this position for at least 30 seconds. But if you can hold it for longer, do it because you'll get better results. Try to work up towards a minute, a couple minutes, even towards 3 minutes. Grab your phone, grab a book, just take your mind off of it. I promise gravity is going to take care of the rest. But if you do need a breather, just kind of come up like this, but give this a try. Try to do this for a combined 3 to 5 minutes in as many repetitions repetitions as you like. So to take this one to the next level and get a deeper stretch in the back, this is what you can do. Instead of keeping your upper body supported on your forearms like this, put your hands out in front of you, have your hands roughly shoulder width apart, tuck your chin slightly towards your chest, and take your fingers and crawl forward as much as you can. This will really deepen that stretch. You should feel it throughout the whole back, but specifically really focus on the lower back. So give that one a try. You can also do something similar to what we did with that first exercise by tilting towards one side. So again, if you have right-sided lower back pain or even sciatica, tilt towards the left side and vice versa. But give that a try towards the left, straight, and also towards the right. If any of those positions offer more relief, spend more time in that position. So here's 2 easy exercises that you can do in a chair. For the first one, we're going to want one with armrests that are sturdy and can support our body weight. So just kind of go right to the edge of that chair. You're going to take your hands, place them right on the armrest. I like to have my legs roughly hip width apart, and I place all of my lower body weight, actually I should say all of my body weight, onto my heels during this exercise. Pretty straightforward. Just use your arm strength right here to push your bottom up towards the ceiling. Go up as far as you can. It's kind of like a dip, so you're going to get a really good arm workout with this one. But in this position, you should feel gravity pulling your bottom down towards the floor, helping to open up the lower back, relieving pressure off a pinched nerve. Try to hold this one comfortably for as long as you can. If you have the arm strength, try to do 30 seconds all the way up to a minute. When you need a breather, just come down like this. But try to do this for a couple repetitions, and with each repetition, try to build into it just a little bit more. So to take this one to the next level, let's open up the back just a little bit more by doing some more movements. What we can do is a hula hoop motion like this. So do a big wide circle with your hips. I like to do this about 5 times counterclockwise, switch it up in the opposite direction, and then repeat. You can also do a pendulum motion. You can do it diagonally, circles, squares. Write the alphabet. What you're trying to do is find one certain movement that just hits it the best. It's going to offer the most relief, and at that point, keep building into that movement until everything is nice and loose, so you're not getting any more improvement. For the second exercise, it's a little bit easier to do using a chair without armrests. Again, just make sure it's sturdy enough to support your body weight. What we're going to do also is be on our knees, so make sure to roll up a towel, a pillow, put them underneath them for extra comfort. This one is very straightforward. Let's get really close to the edge of the chair, almost to the point where our legs are touching. Take your hands, grip off to the side. You want to keep your back as straight as possible during this exercise, so don't try to round into it like this. Instead, we're going to place all of our body weight onto our toes and then slightly lift our knees up off the floor, just to the point where they're hovering an inch or 2 above. In this position, you're going to feel that deep pulling traction in the lower back. And again, it usually feels really, really good. Try to hold this one for at least 30 seconds, but longer if you are able to. If you need to relax, just come down like this. But try to do this for about 3 repetitions. And with each repetition, try to build into it just a little bit more. To take this one to the next level, start throwing some more motions in. So you can do that pendulum motion, taking your hips from side to side. You can also do that circular motion in both directions, or any movement that you find offers more relief. And once you do find that, try to spend more time in that position. With this exercise, we're going to focus more on strengthening. If you want long-lasting nerve pain relief in the lower back, you have to strengthen the muscles that support the spine and the back. Here's a really easy one that you can do right in bed, and it's perfect to do daily. What I'm going to do, start off lying flat on my back, have my legs roughly hip width apart, knees bent, feet flat. Let's take our hands, put them right on our hips. Let's start off by loosening up the muscles across the pelvis, into the hips, into the lower back. This is called a pelvic tilt. What you want to do is pretty much mimic somebody poking you on your stomach, how you tense up, especially across the abs. Hold that and then squeeze the glutes very gently. And then you're just going to rock your hips forward and backward, kind of like taking your tailbone, curling it upward towards your belly button. You should feel a lot of muscles start to fire across the hips, into the pelvis, but try to feel it into the lower back. Hold this comfortably for a second or 2, and then you're going to go in reverse. rock your hips back. We're kind of now taking your tailbone and pressing it into the bed. But do this nice and slowly for about 10 to 15 repetitions in both directions. And with each repetition, try to build into it just a little bit more. We're focusing on trying to build as much movement in the hips and the back as possible with this one. Afterwards, see how it feels. If it feels like there's still some tightness left and this is really helping out, you can throw in as many repetitions as you like. So now let's take this one to the next level and strengthen some muscles. We're going to do what is called a pelvic bridge. So again, we're going to tighten or brace our core muscles that we just did, squeeze the glutes. This time around, I like to take my hands, put them right off to my side for support. And you're just going to lift your hips and pelvis upward towards the ceiling until your body is in a nice straight line from your knees to your hips to your shoulders. If you're unable to get into this position because of weakness or pain, like let's say you can only go up an inch or two, do the best you can. Hopefully over time you'll gain strength and flexibility, but you should feel a ton of muscles start to fire. The core, the lower back, the glutes, the legs, everything that helps support the back and the spine. Hold this comfortably for 3 to 5 seconds. You're going to relax, and then you're going to repeat this 10 to 15 times. And with each repetition, again, try to build into it a little bit more. Afterwards, if it feels like you have a little bit more energy, try to throw in another set or two. If the exercises help, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.